Joining me now is New York City Councilman Mark Levine, who is chair of the Council Committee on Health. Thanks so much for taking the time. Look, the governor has been very blunt about where we are. But one of the most shocking statistics I saw was that in a 6-hour span, 124 New Yorkers died of the coronavirus. That's a death about every 3 minutes. So far, nearly 1,000 deaths in New York City alone. So what is your best intel? If this isn't the peak, what will New York look like in 2 to 3 weeks, Councilman?
Well, by any forecast, April is going to be brutal. Our hospital systems are already maxed out. There are no more empty beds. There are no more empty ventilators. Staff is being pushed extremely hard, shifts of 12 and 14 hours. And more patients are coming in every day with more serious conditions. It's to the point that hospitals now have to turn away COVID patients unless they are extremely, extremely sick. Patients with the equivalent of walking pneumonia from coronavirus are being sent home because the system can't handle it. Forecast ahead a week or two. This is going to be something that New York City has never experienced. I don't think this nation has ever experienced, and we need help.
So you just called on the government to open up beds at the Javits Center and on board the USNS Comfort to COVID patients who are moving out of ICU beds. Those are all, as I think most people know, sites for non-COVID patients right now. Are you that concerned that the city is underestimating its needs, that, in fact, even with all of the hospitals dedicated to COVID patients, it won't be enough?
Look, we are so grateful for the USNS Comfort. When that ship sailed past the Statue of Liberty yesterday, I think it was an image many of us will never forget. And we're really grateful for the field hospital that's come to life in the Javits Center. But the original plan for those facilities, that they would treat non-COVID trauma patients, is no longer workable. We need to turn the core hospital system of this city into what is in effect a giant ICU for COVID patients. They have patients who are no longer in critical condition, who are still in hospital. They can't be discharged. They can't go home yet. They're not well enough. We need to move them out because the hospitals have no more room. That's a perfect role for these federal facilities. They need to accept COVID patients as step-down facilities so that the resources in our core hospitals can be dedicated to those who are truly, truly in dire conditions.
Well, speaking of key resources, of course, that's the folks on the front lines, doctors, nurses, other health professionals, and they are sounding increasingly desperate. There was a nurse at Jacobi Medical Center in the Bronx who told the New York Times, "I just feel like we're all being sent to slaughter," and he contracted the virus along with his husband. I want to play a clip from one New York doctor's video diary for you.
I just got out of a long, grueling shift, and I'm actually losing my voice, and we'll have to probably put some facial cream on from wearing this N95 mask. It's getting worse. This war is going to take weeks, if not months.
We have been rightfully focused on healthcare workers getting the safety gear that they need, but what about the rest, the mental health support they need? I talked to one doctor in New York who told me that there are a lot of folks who believe that these doctors are going to end up suffering from PTSD. What can you tell us about what's out there to help the city's weary frontline workers?
This is a brutal storm for healthcare workers because the flow of patients is surging at a time when their ranks are thinning because so many of them are out on medical leave with COVID symptoms. And it's so frustrating for them because there's not that much that they can do for most patients other than support and stabilize them and hope that the patient's immune system takes over. So they're human beings, and they're seeing the suffering of patients, and it's not easy on them. Those of us who are lucky enough to shelter at home need to understand what these heroes are going through for us and for our loved ones. And we can only help them by replenishing their ranks. So the governor has put out a call nationally that if you're in a part of the country that's not yet in crisis, come here, doctors, nurses, patient care assistants, come here. We need your help. We'll put you to work. And as the governor has explained, when we get over the worst of this, when we're on the back end of this curve, we will send our people to you. We're willing to support the rest of the country. But right now, we are America's Wuhan. China sent 40,000 doctors to that one city. And we need the national support right now from other regions who are not yet suffering to the degree New York is.
New York City Councilman Mark Levine, we thank you so much for taking the time to be with us, and good luck as you try to navigate this as one of the people who I know is probably dealing 24/7 with not just the council work but constituents. So I thank you.
Thank you, Chris. Be safe.